Hi, I'm Dr. Mirafati from Mirrafati, continuing our series of educational video about what happened to the implant after 10 years. What are the six most common cause of implant getting changed or implant revision. Number 5 in our list is basically shifting of the implant. Now, the question is always the people ask me, why didn't it happen on the right or the left? And my answer to that is, listen, the implant or your breast, I often tell them, they're sisters. They're not twins. The right breast versus the left breast completely can behave differently. Just like, why is my right side capsularly contracted, not my left? Why is my right is rippling, not my left? They're sisters, but they're not twins. They don't follow the same thing. They have different vasculature, different nervous system, different blood vessels. Everything about it is different. It just happened to be on your body. It's just one or two. So why would there is an implant shifting on the left versus right? Your guess is good as mine. However, if you're a right-handed person and you're putting that implant under the muscle, and because you're doing a lot of motion with that right hand, there's tend to be more shifting on that right side implant because you're under the muscle. Pectoralis major muscle sits like this, implant goes on top of that. So then basically every time you do something, guess what happened to the implant is a lateral displacement because there is no muscle here, right? There's a muscle medial, there's attachment on the bottom. So when you do this, it does that, not that, right? So it's a lateral displacement of the implant. It can happen. Another reason, bottoming out. Remember, we're under the muscle and there's a very thin attachment. Hopefully, whoever you go to, they don't completely detach the muscle. But if they do, guess what happened? As it squeezing that implant out, it can say, hey, you know what? I don't even have to go lateral to do anything. Medial going down is better. There's less resistance. I'll just go down. So it's called bottoming out. It just bottoms out. And again, why one side versus the other? Generally happens if you're right-handed on the right side mostly, but it can happen on the left side too. There's no rule, it can happen on the right versus left. But because of the fact you have more movement, it just happened to be more on the right if you're under the muscle. But does it also happen to go over the muscle? Yeah, you can have any of these things. So again, but when you're under a muscle, obviously now you have external forces, right? External force that actually pushes it in. Now, if you're over the muscle, I'm sorry, so you have internal forces. If you're under the muscle, you have internal forces. If you're over the muscle, there's external forces by squeezing. Maybe your partner likes your right or left better. So basically, it could still have that displacement that we talked about. Asymmetry. If one moves, then it becomes asymmetrical. So then basically now you have shifting of the implant, now you have asymmetry. One's going here, one's going there. And obviously because in every breast there's a nipple areolar complex, right? So if the implant moves this way, the nipple sort of moves this way, right? So you can imagine if the implant sits here, the nipples is there. Now if my implant originally sits in the middle, my nipples was in the center, but now my implant moves to the lateral, what's going to happen to the nipple? It's going to push it inward. So you have one nipple going this way, one nipple pointing down. Or maybe if it's bottomed out, it's pushed down, one nipple is, because remember if it's bottoming out, the nipple is on top now versus this one is in the center. So basically one nipple is going up, one nipple is coming down. So it just have the asymmetry look that pretty much patient want to change. Now, do you have to change? Not really. Static reason. Goes back to your age again. I think in my practice, anybody in their late 40s, 50s, I said, let's change them. Come to me in your 60, questionable, we can discuss it. 70, I sort of talk you out of it. But if you still want to do it, you're the boss, I'll do it. I really respect people who say, I don't care. The oldest implant revision I did, by the way, is on a lady who was 85 and said, listen, I want to have those implants changed. Beautiful, I respected it. And I did it for her. So, my hat's off to this lady. She loved it, by the way. She gave me a great review and she loved it. Another causal reason is what we call Symmastia. Now, that mostly happens when you're under the muscle and you really have a weak muscle and whoever you went to, they went too much medial. Symmastia means there is no division of that, of the cleavage. If you push your implant together, the pockets are sort of touching each other, and mainly that happens under the muscle, but again it can happen over because of an external factor, but it mainly is under the muscle on a thin patient, very thin muscle, or it could be on a bigger patient, but the doctor could have, original doctor must have really jacked it up to go that far medially. Hopefully you pick a doctor that does this for a living and that won't happen. But, you know, obviously sometimes we make the wrong decisions or whatever, and this happens. So Symmastia is when the implants are touching. That looks really ugly, and that gotta change, because now you, instead of having two boobs, you have one giant boob in the middle, and it just doesn't look good at all. So the reasons for changing: bottoming out, lateral displacement, asymmetry, Symmastia. By the way, if you guys like these educational videos, go ahead and hit the subscribe button. Or if you want any more videos about different topics, send me a message and I would love to do it. Stay healthy.